Ready, go.
Ready. Hi, I am Mr. Sarwar Hussain, student of Ibn Sina Medical College. Now I do internship. Today I demonstrate you the examination of general examination. What the things you need for general examination is a watch for measurement of pulse, temperature, thermometer, and light must be white because you supplement the natural light. Then a BP cup and 2 scale in case of race JBP. And now I start the proper examination part of general examination. First, all examination, surgery, medicine, gynae, whatever the examination is, your examination should be started with GICE. That means greeting, introduction, consent, exposure. First greeting, Assalamu alaikum. আমি ইবনে সিনা মেডিকেল কলেজের একজন স্টুডেন্ট। আমি আপনাকে কিছু পরীক্ষা করব, আশা করি আপনার কোনো সমস্যা হবে না। You take the greeting, introduction, consent, and then exposure. GICE. Exposure in case of general examination, you have to expose this part. Hand should be like this. And leg should be like this, exposed up to this area. Okay. And here Mr. Elias from ISMC 12 here to demonstrate me the examination. And general examination started with the examination of the jaundice. আঙ্গুলের দিকে তাকাও। Upper bulbar sclera, we see the jaundice. Lower palpebral conjunctiva, উপরের দিকে তাকাও, we see the anemia. In oral cavity we see 4 things. হা করো, জিহ্বা বের করো. In the dorsal surface of the tongue we see anemia and dehydration. In the tip of the tongue we see cyanosis. In the under surface of the tongue, জিহ্বা বের করো, জিহ্বা উল্টা করো. You can help of the light because jaundice better observed in white light. If you find jaundice, you may say, dear professor, that I wanted to examine this patient in broad daylight. Okay, and in started of your examination, if you think the patient is jaundice, patient is ecteric, you have to expose the window, because in open window the sunlight is come and white light is come, and you properly examine this patient. So in eye we see 2 things, anemia, jaundice and anemia. Oral cavity we see 4 things, anemia, dehydration, cyanosis. Under surface of the tongue we see jaundice. And then come to the hand. In the palmar surface. In the palmar surface we see anemia and jaundice. Anemia, usually jaundice see in the palmar creases. Usually jaundice see in the palmar creases and anemia see in the palmar surfaces. Because bilirubin just deposit in the palmar creases. So I compare with my left hand. Use your left hand in between the hand of the patient. Anemia, jaundice. Then tip of the finger you see the cyanosis. Then you see the nail angle and observe. It should be in your eye level because you observe the nail angle. It usually 150 degree. It will be reduced in case of clubbing. You see the clubbing, cholionychia, leukonychia. Opposite hand, same examination, you see the clubbing, cholionychia and leukonychia. Then go to the leg, you see the edema just above the medial malleolus over the sheen of the tibia. You press about 10 seconds and release it and see whether it is pitted. If edema is present, then it will be pitted. And then you see the finger cleft for any ischemic changes. Then under surface of the leg you see ulceration. Usually decubitus ulcer and diabetic foot ulcer develop in this area. So you again go to the head side. Again go to the head side, and just like this manner you have to raise the patient to see the JVP. Relax your head, raise the JVP and just wake up the patient and totally wake up the patient. Then you see then you see the thyroid gland in your eye level. Then rotate the patient to this side and examination of the lymph node, cervical lymph nodes, submental, submandibular, jugulo-digestic, anterior chain, then supraclavicular, হাতটা একটু উঁচা করেন, supraclavicular, then posterior chain, then preauricular, postauricular, occipital. Then again rotate the patient and lie the patient. And lie the patient. Then again examination, bony tenderness. Over the sternum you have to press over the sternum and see the face, any change in the face. And then in the abdomen you overall see the hair distribution, skin condition and any overall general congenital anomalies. Yes, and then you measure the vital signs. For vital signs, you have to first you have to measure the temperature, because it takes times. So first we place the thermometer in the armpit, then we examine the pulse about 15 seconds and multiply by 4. Pulse about 15 seconds and multiply by 4. Then we count the respiratory rate for 15 seconds. We see the thoracoabdominal or abdominothoracic movement. By movement, we count the respiratory rate. In case of male, the movement is abdominothoracic because the diaphragm is more strong in case of male. In case of female, the movement is thoracoabdominal because the intercostal muscle are more strong in case of female. So we count the respiratory rate and then again measure the blood pressure, then measure the blood pressure, and at last you take out the thermometer and measure the temperature. And now recap. It is the most important part. You have to complete this examination in your exam. You get only 2 to 3 minutes of time to complete whole parts of this examination. So you should be fast, but do not too fast to miss any finding you may get in your general examination. So quick recap, what we do in general examination. First we see jaundice, then anemia, then oral cavity Hakoren, Jibabegan, dorsal surface, anemia, jaundice, tip of the tongue cyanosis, under surface, dorsal surface, anemia, dehydration, tip of the tongue cyanosis, under surface, jaundice. And then come to the hand, both palmar surface, compare your hand, anemia and jaundice, tip of the finger, you see cyanosis, and then observe clubbing in your eye level, cholionicia and leukonochia. If you find any findings, then go further examination. And then in the leg, look for edema, ischemic change in the finger cleft, ulceration in the toe. And then come to the head and again, look for JVP, raise the patient, ask to have the Dhugilan in your eye level, rotate the patient, then see the cervical lymph nodes, total cervical lymph nodes, submental, submandibular, jugular, digastric, anterior chain, supraclavicular and posterior chain, and then again rotate the patient and lie the patient, see for bony tenderness, look at the patient face, and then overall abdomen, skin hair distribution, any skin abnormalities in skin condition, overall any congenital anomalies. Then measure the vital signs, thermometer in the armpit, measure the pulse about 15 seconds, then examination, then count the respiratory rate about 15 seconds, then measure the blood pressure, then take out the thermometer and measure the temperature. Now how we present this case? How we present your general examination? You just say we got about 24 points in general examination. The general examination we have 24 points, so you have to summarize your case. Such as on my general examination, started with A, B, C, D, such as appearance, body build, decubitus, cooperation. Appearance, patient is ill looking. Cooperation, appearance, body build is average. Cooperative, patient is nicely cooperative. Decubitus on choice. Anemia, jaundice, cyanosis, clubbing, cholionicia, leukonochia, edema, dehydration, absence or present. Vital signs such as JVP, pulse, blood pressure, respiratory rates, also within normal limit, or you may find any abnormalities such as raised JVP. You have to include it in your findings. And then you go for skin condition, hair distribution, bony tenderness, congenital anomalies. In this manner, you have to complete all your 24 points of general examination, and then you have to notice some things in your patient, such as cannula in situ, such as may present cannula or patient may catheterized. So you have to, or infusion is going on. So you have to include this finding in your examination, such as cannula in situ, patient is catheterized and infusion is going on, or patient may be nebulized with salbutamol, protopium bromide. So you have to make this finding, you have to include this finding in your interpretation of the examination. In our next section, we have to demonstrate you the some part of general examination such as anemia, jaundice, clubbing cholinergia, leukonychia, and lymph node examination. So this is overall the principle of examination of principal part of general examination.